Some of the challenges that we currently face in Waldenström's can be predicted by the underlying genotype. So for MYD88 wild type patients, these are individuals that don't carry the MYD88 mutation. These are patients that tend to have more aggressive disease, shorter survival, tend to transform more readily. And this does pose a challenge in terms of therapeutics. These are also patients that typically don't do as well with BTK inhibitors as the MYD88 mutated individuals do. Thankfully, this only comprises about 5% of all Waldenström patients, but nonetheless, it does represent an important unmet need. And current standard of therapy for these patients involves either bendamustine or proteasome inhibitor-based therapy. Now, the other challenge involves CXCR4 mutated patients. These are patients who on BTK inhibitors tend to have less deep responses, takes longer by actually a few months to get them into major responses, and they tend to have shorter progression-free survival. Now, with the ibrutinib long-term follow-up, that shorter progression-free survival was actually 42 months. It isn't bad when you consider that these were heavily pretreated patients. But among patients that were CXCR4 wild type, 70 to 75% of them were still progression-free at 5 years. So you do see that there is a difference even with progression-free survival among these patients. And this has also been recapitulated in the Innovate trial. We also saw that depth of response was impacted even with zanubrutinib among CXCR4 mutated patients based on the readout of the Aspen trial. So this is a challenged group as well with BTK inhibitors. But the exciting thing is that we now have trials that are addressing CXCR4 mutated disease. And I'm very optimistic about our ability to be able to innovate around CXCR4. With MYD88 wild type individuals that I mentioned earlier, the genomics are also giving us new insights into their disease. We know what some of the key mutations are that drive MYD88 wild type disease. And I do believe that in due time, we're going to see also innovation that specifically addresses that unmet need.